Welcome to video 22 for chapter 7-8, the skeleton and anatomy and physiology. In this video series, we're going to look at the lower limb, which includes the thigh, the leg, the ankle, and the foot. So with the thigh, we're talking about the area between the hip and the knee. And we have two bones that are common here, and that is the femur and the patella. So the femur is the largest long bone in the body. It is a weight-bearing bone, so it is rather large and it's thick. And we have a couple features that we're going to look on that. The first one is called the femoral head. And this is the articulation with the acetabulum of the coxal bone, which is part of the pelvis. And this is the ball in the ball and socket joint of the hip. And it fits inside of the acetabulum. It's a little bit more fitting than the shoulder joint, which was the other ball and socket joint. And we saw that that one dislocates. You can dislocate the hip, but it's not as common because it fits a little bit more snug. We have two trochanters. So we have the greater and the lesser trochanters, which again, these are muscle attachment sites for some of the larger muscles in the leg, which are pretty powerful. We have the medial and lateral epicondyles. And these are the tibial articulation sites. And they actually form like a cap over top of where the patella rests in there. And we have what is known as the patellar groove, which is our patellar articulation. So if we move to our diagram on the next page, here we can see a diagram of the femur. So this is the femur right here. Here we see the head of the femur and how it fits in the acetabulum. We see the greater trochanter, which is this large lump here, and then there's a small one medially called the lesser trochanter. Down here, we have the lateral and the medial epicondyle. So these are the edges that stick out that meet up down here in the knee joint. This area right here is the patellar groove. And we actually have a rather large ligament and tendons that go up here that encapsulate the patella. So remember, the patella is a sesamoid bone, and it is encased in the tendons and muscles and the ligaments here within the knee. So this diagram here is showing here is the kneecap embedded within all of this material here with the patellar ligament and the patellar tendon up here that runs with the quadriceps femoris muscles on either side. And we have some different ligaments along the sides. So we can see that that is a little indentation right here, and that allows some movement of those tendons and ligaments. So talking a little bit more about the patella, we said it was a sesamoid bone. It is located within the quadriceps muscle tendon group. And it's attached to the tibia via the patellar ligament. That's the one that they hit whenever they do a patellar reflex. And there is a really good reason for having that. This is a very high stress joint. So this adds some protection, but having that bone in there changes the angle of the tendon. And when doing that, it is a lesson in physics. So it changes the angle of the tendon, which in turn means a greater force can be applied to the muscles of the tibia, so less contraction is needed. So by changing the angle of the tendon, it increases the amount of force to allow the leg to extend and contract. So it kind of increases the mechanical advantage of this joint by having that in there.